Welcome back. Right now, more dermatologists are prescribing women a blood pressure medication to help treat acne.
Yeah, that's right. It's been approved since 1960. Here to talk more about its effects is 9 News medical expert Dr. Payal Kohli. Dr. Kohli, good morning.
Good morning, guys.
Okay, talk to us a little bit about this medication and how it works for acne. A lot of people want to know out there.
You know, it's funny, as a cardiologist, I've been using it for decades for blood pressure, for congestive heart failure. It's a diuretic and it helps your body excrete sodium and it kind of reduces the blood pressure in that way. But what we realized in the last couple of decades is that it also has effects on our hormone. So what it does is it blocks androgen. And in women, especially who get a lot of acne, especially associated with their menstrual cycles, what happens is they have too much testosterone, because we know that the ovaries make testosterone. This stimulates the oil production, sebum, it's called, in the skin cells. And so you get these like little cysts or little pimples that are kind of fluid-filled pimples, usually on the bottom half of your face. And this medication can work incredibly well to get rid of that type of acne.
So it's effective. How long does it take to work?
So it usually takes about a few weeks for that oil production to start to go down, but the acne to clear up can take about 3 months. But the American Academy of Dermatology says that it is actually like 50 to 100% reduction in acne. So you can see a really dramatic effect, especially because the type of acne that you tend to see with hormonal acne causes a lot of scarring and inflammation. So it's those really red, angry pimples that can leave behind marks as well.
Which sets up my next question just nicely. Which types of acne would you really recommend for this medication?
So there are women, I mean, there's many different types of acne, but there are women, including not just adolescents, but adult women that get this hormonal acne. And the way that you know if it's hormonal acne is usually if it's cyclical, meaning it follows kind of along with your menstrual cycles or with pregnancy or with hormone fluctuations. And also if it's that bottom half of the face. Also the way the acne looks. If it's teeny tiny pimples, it's probably not the hormonal acne, but if these big kind of cysts on your face that look inflamed and full of fluid, which is actually oil, that's the kind of acne that it's very effective for.
Who shouldn't take it and what are the side effects?
Yeah, so the medicine is a teratogen. So if you're pregnant, you know, because often pregnancy can trigger hormonal acne, so you might think it's something you want to take, or if you're breastfeeding, you absolutely shouldn't take it. It also changes the potassium and sodium balance in your body. So if you have kidney disease, you want to be really careful. And then, as I said in the beginning, it helps your body get rid of sodium. It's a diuretic, so you can get rid of fluid. So it can cause dizziness, it can cause changes in your blood pressure. And this is where we have to start being very careful, because obviously it's a cosmetic treatment, makes our acne better, but at the same time you don't want to take such a high dose that it can cause blood pressure problems or side effects like dizziness. You can have breast changes. If you're a man taking this medication, you can actually have breast growth because you're thinking about blocking testosterone.
Right, sure.
So this is called gynecomastia. Men can grow breasts, and that can be very troublesome as well for how they feel about their self-esteem.
And then what about like younger people too? Because, you know, thinking like when you go through puberty, teenagers, that's typically who deals with acne a lot of the time.
Yeah, I mean, we are using it in our teenagers, but we have to be careful, right? Because they're growing, and it's not just about the hormones and the puberty, but it's also about their overall growth. So obviously this is a prescription medicine. I would be very close contact with the dermatologist before starting it, but getting somebody on it can be really change their appearance, because those acne scars, if they occur during puberty, can really last into your adulthood and traumatize you.
It really is so interesting.
Yeah.
Well, Dr. Kohli, as always, appreciate you coming in. And of course, you can find all of Dr. Kohli's appearances on 9news.com/Dr. Kohli.